So we have both male and female clinicians available, and if you receive an appointment with a male and you would prefer to be seen by a female clinician, please don't hesitate to get in touch with us at the earliest opportunity, and we will certainly make your choice of a female available to you. When you initially come into the consultation room, you will be taken in to see your clinician first of all. Occasionally they do have a learner with them, so that could be a student nurse or a medical student. In this part of the consultation, they will be just taking your history, so they'll be asking you questions about your history. For example, your past medical history or any medication that you're taking. They will then talk about the procedure itself. Once you've had your consultation, they will move you across to the treatment room where the colposcopy will be conducted. In this room, there will be 2 additional members of staff. Both of these members of staff are there to support you and support the clinician. They tend to be a registered nurse and a healthcare assistant. You are more than welcome to bring someone with you. Whether that be for the whole procedure, the whole consultation and procedure, or just for the consultation itself, that's not a problem, and we can easily facilitate that for you. We would encourage you still to attend if you are having a period. We appreciate that this may be comfortable for you, but even if we see you to do the consultation and explain to you the procedure and you still feel uncomfortable, then we can postpone, but we would strongly encourage you to attend in the first instance. When you come for your examination, we will offer you a gown to get changed into. Some people find it easier to come with a skirt, just so there is a minimal amount of clothing to take off, but it's not necessary if you don't have one or you don't want to. Just come along in your normal clothes and we will provide a gown for you to get changed into before your examination. We would recommend avoiding any alcohol prior to coming up to your consultation, but other than that, you can carry on as normal. This will depend on what the examination entails. Every examination is slightly different depending on what we need to do. If it is just a colposcopy alone, you can carry on as normal afterwards. If we need to take biopsies or do a treatment to your cervix, we would advise that you avoid intercourse, tampons, swimming and strenuous exercise for a period of time afterwards. But we will go through this with you at the time of your appointment to ensure that you fully understand. You will also take away written information which will clarify this for you. For some people, they prefer to take time off work. If you're just having a colposcopy, you wouldn't necessarily need to. However, as I said, for some people, depending on the roles that they have or the jobs that they do and how they're feeling in themselves, it may be beneficial to arrange some time off work afterwards. Examination is, I would say, probably uncomfortable more than painful, but you are very much in control, and if at any point you want us to stop the procedure, we will, either to stop completely or for you to catch your breath and then we would continue. Occasionally you will need to come back to see us in colposcopy afterwards, but we will make this clear to you when you leave the department. Occasionally you have to wait for results, and any follow-up will be decided on those results. Again, we will make this clear to you after the appointment. For some people, their follow-up is done at their GPs, but again, this will be made extremely clear in written information after the appointment. We would ask that you make every effort to attend, but we do understand that things happen in our work and life. If you do miss it, we would be grateful if you could contact us at the earliest convenience and we can attempt to make a further appointment for you. No. The abnormal result will pick up the human papillomavirus and or abnormal cells, but these cells are normally, for the vast majority of people, early warning signs that when you come to colposcopy, we can perform biopsies or treatment to prevent them developing into anything in the future. The results will normally be communicated to you within 3 to 4 weeks of your attendance at the clinic. Sometimes it's a little bit quicker and sometimes it can take a little bit longer, but roughly 3 to 4 weeks. If it has been a little bit longer, you can always contact us and we can double check the results for you.
Usually you will need loop biopsy treatment in clinic on the same day. This should be enough to remove cancerous cells. However, on the rare occasion, some people need more treatment. But if this is the case for you, then we would support you through this. Our staff in our clinic are very supportive. You can contact us as well if you need any further information, and there will be a link on this website for any forums that you can utilise. If you are pregnant and you have had an abnormal smear, we still recommend for you to attend your appointment. We wouldn't take any biopsies or anything, but at least this gives us the chance to still look at your cervix. We are here to support you. If you've been through something traumatic, please speak to us. You can contact us before your appointment also if you feel that you need to speak to us for support. There are a lot of transport options. There is a car park on the site as well, and if you do need to contact us, you can, and we can talk you through some of the options that you've got to get here. Please contact the department before your appointment. Our nursing staff are more than happy to talk to you and explain to you what to expect in your appointment. Most abnormalities in smears are caused by the HPV virus. These have been linked to smoking, so anybody with an abnormal smear, we would advise you to seek support to stop smoking. If you have symptoms such as bleeding between periods or bleeding after sexual intercourse, then you should seek some advice from your GP.